Hello and welcome to the People Doctor Show. My name is Latif Mumuni. Today we are discussing wellness clinics. The People Doctor Show is proudly brought to you by SG Mobile Healthcare, a lead global people socially centered organization operating in health, sanitation and research. We are privileged today to be discussing wellness clinics with Dr. Damien Punguyiri, the Upper West Regional Director of Healthcare Services. Doc, you are welcome to the People Doctor Show.
Thank you.
It's an honor to have you, Doc.
Yeah, it's a pleasure to be at your show.
We are particularly happy that out of your many busy schedules, you make time whenever we are here to discuss, particularly putting healthcare information to the simplest form so that the youth can relate with.
I'm on it.
We are on it. Doc, if I may ask,
Right.
what is a wellness clinic? I thought all clinics were to make us well.
Yes, so if you know about our history, when someone says I'm going to the clinic, it means that the person is either sick and is going to the hospital, or he has attended the hospital, they give medication, they say come for review. So that is what we know of a clinic.
Okay.
Now, we now have realized that a number of disease conditions and risk factors for non-communicable diseases, they don't usually show up physically for us to see. And before you realize, the person is acutely ill and then they die.
Oh, okay.
So the wellness clinics have come to help people to identify their hidden problems even before they become visible, where you can see that the person is having signs and symptoms. So a certain area in a hospital can be designated as a wellness clinic, so that people who are not sick can just walk in and then you say you are coming to assess your health status.
Okay.
So that is what we call a wellness clinic.
Okay.
I can accompany a relative to the hospital who is sick, and then I take advantage of my presence in the hospital to visit the wellness clinic and get interviewed, and then they take my blood pressure, my sugar level, depending on other, they take your height, your weight, and check your body mass index, and all these things will point to your level of health.
Okay.
So that is the concept of a wellness clinic.
Okay, that means we have already just a facility, but within the health facility there is a designated area called a wellness clinic, right?
Precisely.
Thank you. Doc, you use the word communicable here.
Yes.
Like here on the People Doctor Show, we want to keep it simple,
Yes.
devoid of medical jargon. If you could please break down the word communicable. You said the person may be having communicable disease or non-communicable.
Right. So the word I actually use is non-communicable.
Okay.
So when you say a disease is communicable, it means this disease can be passed on from one person to another through a contact.
Okay.
Because it can be transmitted from one person to another through close contact.
Okay.
And that is what we call what? Communicable diseases. Like malaria, typhoid, COVID-19, these are communicable diseases.
Okay. Okay.
Now we have other group of diseases that cannot be passed on from one person to the other. For example, if I have high blood pressure, by touching you, you cannot get high blood pressure. If I have cancer, if I sleep with you, play with you, I cannot get that cancer, diabetes, and all sorts of other diseases that cannot be passed from one person to another. Those group of diseases are called non-communicable. They cannot be passed on. They are like communication.
Okay.
Communication is passing something to someone. Non-communicable means cannot be passed on from person to person through a contact.
Okay. Viewers, I'm grateful to Doc because I have a pathology lecture exams coming up. I've taken notes. Thank you. But Doc, why should someone visit a wellness clinic?
Yes, so like I mentioned earlier, you visit the wellness clinic when you are not physically sick.
Okay.
Because you need to check, how well you are.
Okay.
We send our vehicles routinely for checkup, even when they don't have problems, isn't it? You drive your car after some time, you say, okay, let me go and check, and so on. The human body too is like that. And like I mentioned, some of the diseases that cause now are major causes of death, like stroke and cancers, like high blood pressure that can damage our liver, kidneys. These group of diseases, they come in very slowly. You develop hypertension. When you have hypertension, you might not know that you have high blood pressure until you probably develop a stroke or heart attack.
Okay.
So when you go to the wellness clinic, they'll assess you to first find out whether you have developed the condition.
Okay.
So they check your blood pressure. If it is high, then they know you have blood pressure. They check your sugar level. If it is high, they know probably you have diabetes. But then you also, when you go to a wellness clinic, they can also check the risk factors for these diseases.
Okay.
So when you go there, it depends on the level, the person will interview you about your lifestyle, the type of food that you eat, the amount of exercise you do, and all that. Then they check your weight, they check your height, and then calculate what we call body mass index. These are, levels of weight that is good for the human body. If it is too low, it's a problem. If it is too high, then it exposes you to the so-called non-communicable disease.
Okay.
So when you go to the wellness clinic, first of all, you screen for early detection of these diseases. Then they also screen you for what? Risk factors for these non-communicable diseases. And then they give you education, lifestyle modification that will help to reduce your level of risk.
Okay.
So that is why it's important to visit a wellness clinic.
Okay. Are wellness clinics actually open 24/7? Are they open all day? As far as the facility is working, are wellness clinics also open? Like for instance, I take my own mother to the hospital midnight. Can I walk into any of the wellness clinics, or there are times they close down?
Yes, so the concept of wellness clinic just started.
Okay.
And so they work during the working days,
Okay.
like Monday to Friday. And, if you go to most places,
Okay.
that's how the wellness clinics work. So during the working days, as people bring their relatives, as people, they are walking up, they are going somewhere, let me pass through the wellness clinic and check myself. So that is what is currently being practiced.
Okay.
But as time goes on, they could extend to, let's say, weekends.
Okay.
We are also even trying to, expand it to CHIPS level.
Okay.
We are in this region. We have been working together with JICA.
Okay.
Through something called the JICA CHIPS for Life, life course approach, where the community health nurses, their capacity is being built to be able to do this screening.
Okay.
So that when they go on outreach services, they can, apart from doing their routine things, they can also screen people, for these non-communicable diseases. And when the people come to the CHIPS compound, they can also be screened.
Okay. What a concept. And I'm happy that it's being rolled out, and it's a work in progress.
Sure.
Which means with time, we will soon have 24/7 wellness clinics. But Doc, may I know where I can find a wellness clinic if I walk into the hospital? You know the OPD is available, it's easy to identify, then maternity and other places are easy to identify. So should I walk into a facility now, how do I identify that this particular corner is a wellness clinic or this area is wellness clinic?
Yes, so each facility has different designation. For example, when you are entering the municipal hospital,
Okay.
you see the map of the facility.
Okay.
Drawn, showing directional signs.
Okay.
So you can look at the directional sign and say that if I move this way, I am going to get to the wellness clinic.
Okay.
Others, they label the area, the wellness clinic, and when you get there, you see the equipment that are used there. So that is currently what is different things are being applied at different facilities.
Okay. But I know, Doc, you also know that for people within my age, we look very healthy. Young people look very healthy. We are free to go.
Right.
A mentor ever told me that being fit is different from being healthy. But for us young people, we all look fit, we all look healthy. Why should young people walk into a wellness clinic? Because I already look fine, I'm fine. That's what we all see, young people.
Unfortunately, we are beginning to see, and I believe you have friends, young people,
yes,
sudden death, yes, and you don't know what has killed the person. Sometimes they start blaming family members, witchcraft and all that.
Yes.
The prevalence of non-communicable disease, they are increasing and increasing and increasing because of what we call demographic changes, demographic transition, developmental problems as well. Development has come with its own issues. Years back, you see children walking miles to school. They went out to play, climb trees, and eat a lot of fruits. Because of development and for security reasons, parents will not allow their children to walk to school. Okay. Some take them, they drop them with snacks, so they go and sit. And also, preference for some so-called private schools. You go there, small space. So the risk factors now even develop from early age. So by the time the person becomes adolescent, an adult, young adult, and all that, they are there. You see people walking very big. You check their BP is high, sugar levels are all high. The diet that we eat, you're no longer getting the fibers, a lot of rice and things like that, chicken, very fatty. So these factors are very common now. So it's important that all of us, no matter how fit you are, you take time to go to the wellness clinic, check your body, they check your height, they check your weight, check your body mass index. They will talk to you about your lifestyle, and then they will prescribe a level of exercise, a level of diet, and all these things for you. That will help you reducing your risk of developing these diseases.
Doc, whilst working at the Dogley Health Center then, before I moved to the regional hospital, we had this corner. We used to call adolescent health corner, or adolescent health center corner somewhere that the young people could come discuss. What's the difference between an adolescent health corner and a wellness clinic?
So, adolescent, I believe you know the word adolescent.
Yes,
for some
for the sake of my viewers,
individuals who are between the ages of 10 to 19. You see, an adolescent, when they get to 10, 11, that's a period that they are beginning to pick up self-identity. They are beginning to question, certain decisions of their parents and their community members. These are the period that they are more likely to explore their environment, the physical changes, emotional and psychological development are taking place. And that's a period they are also prone to adopting lifestyle that can be dangerous, like smoking, alcohol, unsafe sex, and other dangerous lifestyles. So the adolescent health corners are meant for people within that age categories. They go there, they take them through, there's a collection of items they use to learn responsible sexual behavior, avoidance of alcohol, smoking, all these things. They're being discussed, at adolescent health corners, contraceptives, and so on. So that is the concept of adolescent health corner. They meet a particular age group that if you leave them to go through life as usual, they are likely to go wayward.
Okay.
So that is how the adolescent corners have been created to deal with.
Okay.
And then so it's quite different from the wellness clinic.
Okay. Okay. I understand very well now. So meaning a wellness clinic is open to all of us. But an adolescent clinic have a target group of people. We are very much grateful to have you, Doc. If you have any final words for us.
What I would say is that it's a great pleasure to have you, and I'm happy to use your platform to engage young people. We hope that this will go a long way to help people understand, and we're ready for questions and feedback. When people get those questions, you can bring back, we can always discuss.
Okay. Viewer, I am happy to hear Doc say he's available. If you have any question, please keep it rolling on our comment section. And you can send your questions also to our social media handles. It's at SG Mobicare on Facebook, at SG Mobicare on Instagram, at SG Mobicare1 on Twitter.
We are going, heaven knows where we are going.